Hey, everybody. Welcome to the very first episode of the Global Health Impact Network podcast. I'm your host, Martin Eels. And today I have an amazing co host with me, who is actually the founder and CEO for the Global Health Impact Network. Gary, welcome.
Thank you, Martin. It's a pleasure to be here and a pleasure to discuss a little bit of background behind Global Health Impact Network.
Please, we'd love to know a little bit more about you, and then, let's know more about the network as well. So,
Great. I always start out with what's not a short story, so I'll try to be as brief as I can about how we got here. I've spent the last 35 years in healthcare. I started out as a dentist, actually, so I've got an interesting background. Went from dentistry to anesthesiology, and I became a dental anesthesiologist. And through that practice, got more interested in anesthesia than the dental practice. Wound up going back to medical school and becoming a full-fledged anesthesiologist after medical school in Philadelphia. Trained, did my residency at Harvard, at Brigham and Women's, and Mass General, Beth Israel Hospital. Focused in on obstetric anesthesia and neuroanesthesia through some fellowships after my residency, and then met my wife, who's a maternal fetal medicine doctor, who trained at Harvard as well, and we wound up coming out to the Bay Area in 1989. Once we came here, I've been in practice for over 33 years at the same institution in Berkeley, California, part of the Sutter healthcare system. We have 27 hospitals, and practiced for a number of years, and then got to the point of the early 90s, around the time, showing my age, that we were still using 56K modem dial-ups, and the Yahoo portal had just come out, and this cool thing just down the road that was supported by Silicon Valley was this internet. And got exposed to a number of companies that were starting up during the bubble of technology, and said to myself, there's got to be something great that we can do with healthcare, and this internet. At the time, was involved with continuing medical education with my practice and my medical staff in my hospital, and I said to myself, it's such a cumbersome process to complete the required medical education as a healthcare provider, especially as a physician. State licensure requirements, board certification requirements, board recertification requirements. It's expensive. It was cumbersome. It was inconvenient. That why couldn't we do it or at least accomplish it on this new internet? But again, bandwidth limitations, technology limitations. We sat down and talked about it a while and realized that what we could do was create a portal first, similar to this new Yahoo portal that was out there, where you could say, hey, I'm a cardiologist. I'm going to be off for 2 weeks. I'll be in Florida during that time. Tell me what's the 10 courses that exist within a 20-mile radius of what we're doing. And it actually resounded amongst my colleagues. What a great idea. So, pre-Expedia, Travelocity, we would help people find courses. We would book their travel and book all the accommodations with a real travel agent in those days. And we leveraged the portal on the internet. But then it became apparent that most of my colleagues really said, why can't I do this on the internet? So we started to create with this new Microsoft product called, PowerPoint, looking at creating lectures and continuing education on the internet, developed a learning management system platform for that, and ultimately started putting content on the internet. And as a matter of fact, it's right behind me. You can see the sign up there. It's called the Continuing Education Channel from, probably 26 years ago. So we built that, and it was quite successful. We wound up being acquired by an organization called Challenger Corporation, who acquired the technology, and they were in business for quite a while, sending CD-ROMs and cassette tapes to people for board certification, recertification, some CME, and took our platform and got on the internet. And they're still around 25 years later. So that was my first foray into digital health. Since that time, fast forward, I've been involved in two other digital health companies. The most recent was an online provider data management credentialing platform called Modio Health, which was acquired by CHG, a staffing company, about a year and a half ago. And at the same time, during all of that, believe it or not, I was traveling around the country as an informaticist for electronic healthcare records with Epic, for Sutter Health in our 27 hospital system. So I had an opportunity to be at the elbow supporting a lot of my colleagues with electronic healthcare records. And it was quite apparent that a lot of my colleagues were disenfranchised. They were unhappy. They didn't like the idea of having to use electronic healthcare records. They felt that healthcare was becoming more out of control for them. They didn't feel like they were an active participant in the future of healthcare. And it really, it was really, it hit home for me as a serial entrepreneur and an informaticist. So I realized that the next 20 years of my life, getting closer to retirement in my early 60s, needed to be to create an environment that actually promoted and made it easier for my colleagues to actively participate in this evolving digital health revolution that was in front of us post electronic healthcare record. So that's when we created Global Health Impact Fund. And I believe you've spoken to one of my partners, Oren Aloni Charas, a bit about that. And I was the founder for that initially, and that evolved into Global Health Impact Network, which now is a clinician-driven global network focused on innovation and healthcare tech. So basically, that's how we got fast forwarded to this point where we've been working on that for about 3 years.
Wow. That's one hell of a story. That's awesome. Obviously we know Owen very well and we know the funds. So tell us more about the network. Why have we built this network, and what's the vision going forward with this?
Great. So, when you look at from a business perspective, creating a network is not an easy thing. It's not like they just started up Google or they started up a lot of the networks that are out there now. It's a long drawn out process which involves member involvement, member engagement. So for us, what was the problem, and what was the mission and vision of what we were trying to create? So at the end of the day, as I mentioned earlier, we were trying to create an environment which actively promoted participation by clinicians in this digital health revolution. So what does that really mean, right? So we were looking to create an environment that promoted communication, collaboration, education, innovation, and active participation in this digital health revolution that I keep mentioning. But how do you get there, right? It's not something you just pop up and if you build it, they will come. So me being pragmatic and being a serial entrepreneur, there's very little that you can do without money. So the first step is to create an environment to create the capital to be able to build the network. But at the same time, almost a beta test of creating the network itself. So what we did was we started a clinician-only funded venture capital fund focused on digital health. Okay, which gave us the opportunity. It gave us the capital from the users and clinicians that needed to make the right decisions, right? How do we avoid the Theranos investments of the world, right? So we started looking at companies and targeting our investors based on the investments that we were making. And again, you probably heard much of this from Oren, but from my perspective, I was really using that model to create a small manageable network of targeted clinicians based on the investments we were making. We were making investments in digital health companies that were remote patient monitoring companies, somewhat disruptive technologies and ability to monitor blood pressure and fetal well-being, things like that. We were looking at platforms to improve the efficiency of electronic healthcare records and the delivery of care. But at the same time, how were we making those decisions? So we were creating a very targeted network of clinicians who were helping us do the due diligence,
Okay.
pick those appropriate companies, and they were also investors as well. So that was our, I would say, beta test of the first phase of the network.
Man, that's awesome. And we know we have all these clinicians and a lot more people as well onto the platform, which is an amazing platform. I gotta say. So, do you want to talk a little bit about the platform and what we're doing with the network on there?
Absolutely. So, so we went from the fund, we had this targeted, a venture fund allows you to have about 99 investors, right? So we had a small network of 99 clinicians across professions and specialties. So we started looking at creating a network that was focused on creating communities around professions, specialties, and special interest areas, right? So, with the idea that it's great to create a network, but what we really needed was a secure, environment that allowed collaboration and communication around these subjects in a protected way. Because, if you look at what's out there right now, there are plenty of networks out there. You've got Facebook, and you've got you've got LinkedIn, and you've got all these other environments. But when you're on, and again, I've been using them for years, but when you're on those network environments, whether you're there with auditory, solutions, or video solutions, or asynchronous communication, you're never really 100% sure who you're collaborating with, because they're not secure networks. A lot of your information is being shared with other places.
Yeah.
So that was a problem for me from a provider standpoint. I wanted to be in an environment where I knew that I was collaborating with other healthcare professionals, and I could be assured of that. So the idea was, well, how could we do that? Well, yes, we could go out and partner with the big players out there, the LinkedIns and the Zoom and the Dropbox and the Slack. And, having created 3 platforms before, that to me was a bit of a nightmare, even to engage in that at this point in my career. And then it was almost like kismet. It was fate that I was at a Society for Physician Entrepreneurs meeting, supported by some colleagues of mine who I knew well because of the venture fund. And there was a group of individuals who had developed exactly that kind of collaborative communication platform focused around security, video encrypted communication, the ability to store documents securely, like a Dropbox environment. And they had put it all together, and they had built it for a 10,000 employee organization in India,
Okay.
and had it working. It was a server-based solution, and were taking it now and wanted to use it for a social impact environment in healthcare. So their focus was to take this platform and use it for federated non-for-profits like the March of Dimes, cystic fibrosis, all these other, non-for-profit organizations in healthcare that were supporting healthcare in a social impact way. Well, I said to them, "Well, where are you?" And they had a great platform, but they didn't have a company, they didn't have any money, they didn't know how they were going to do this. And I said, "Well, we've got a venture fund, we've got a network, we've got providers. Why don't we come on board? We can fund moving it from a server-based solution to a cloud-based solution. And the first 2 solutions that we could build in beta test are Global Health Impact Fund and Global Health Impact Network, as a network solution for what we need to do for those business cases." So we partnered. We started the company. We named it Hands In, like LinkedIn. Right now, it's Hands In, and it had all of the functionality that we needed for safe, HIPAA compliant collaboration in a secure network. So that was the real start of Global Health Impact Network. So we started with a small group from the fund, and then we now, here we are almost 3 years later on the fund, and a year and a half later on the network. And we've pretty much organically grown the network to close to 1,000 members. And we've created an environment where we're creating now communities around professions and specialties, and special interest areas like blockchain and physician burnout. So that's how we've gotten to this point now, where we're now building this network that we had envisioned to build.
Yeah. And we do have some really nice communities on there as well. Like, what's the benefit for these people to come on and create a community or join a community on the Hansen platform?
Right. And it's interesting. We spent a lot of time looking at, from a business perspective, what's the problem, what's the solution. But it's fairly broad in concept, because when you're out there as a consultant, traveling across the country talking to my colleagues, what was the problem? Well, the problem is here, and here we are again, unplanned in the middle of a pandemic. So you have all these clinicians that are out there that are working very hard in a very complex environment using an electronic healthcare record system that is really not interoperable. It doesn't make their life any easier, and they find themselves being exposed to digital healthcare solutions in which they had very little input into the solutions. So the biggest quote unquote problem or complaint for them was, how do we actively participate? We're so busy doing what we do. How could we do what you've done in the last 25 years? I'm lucky. I'm the Pollyanna. I'm the anomaly who's crazy enough to do all these things. Because when I see a problem, my first response is, let's put a solution to it, right? No matter
Yeah.
what it takes. So the goal there was to create that environment, and actually it's been great to see clinicians who were, the term that I use, is one trick ponies, right? They're out
Yeah.
there practicing clinical medicine, doing what they were trained to do, doing what they wanted to do, but now wanting to be more actively involved in this evolution that's in front of them. So we've created that environment for them. So when they join the network, they can join a group of like-minded clinicians, whether it's around a specific subject matter expertise like a specialty or a profession, or whether it's around an interest like, I'm interested in technical solutions for physician burnout, or I'm interested in blockchain and healthcare, or I'm interested in getting involved in some area of interest that I have, but I have no idea how to get introduced to other to startups, to innovators. So we're creating an environment where they can all collaborate in a way that, if a clinician wants to be an innovator, or if a clinician wants to be an investor in a company, how do I do it? Well, so again, that's the focus of communication, collaboration, but then education. So we're creating an educational network within our network, so that we're educating our colleagues about how to become an investor, how to become invested in a venture capital fund or an angel investment group, how to become an innovator. How do I take an idea and see if it's worthwhile taking it from idea generation to capitalization and commercialization? So we're creating this ecosystem within our network of not only clinical communities, but communities around what's necessary to accelerate companies and and create a company in a way that leverages individuals who've either already done it, or individuals who are expertise at helping entrepreneurs who are startup CEOs. So
Yeah.
um, kind of that's where we, what where we're working towards in the network.
Yeah. In the short time I've been part of it, we've done quite well. The education series is continued to be built out, like the knowledge sharing of it, which is great. You touched based on like Accelerate. Let's talk about the Accelerator.
Great. So, again, having focused for the last year and a half on the platform, on the network, on member engagement, member growth, um, it's been clear based on the metrics and through interactions with the current members on the network, that what a lot of them were looking at as innovators is the ability to come up with an idea and then take it through a process. And again, we're not reinventing the wheel here, to take an idea through a process that helps them um, idea generate and then accelerate the idea in a in a system that is a curriculum, right?
Yeah.
So how do I start take an idea and then create an environment where I can bring in the appropriate management team for a startup? How do I raise money, from seed all the way to pre-series A, from angels, from individual clinicians, from potentially venture capitalists? How do I, if I'm doing a device company, how do I worry about intellectual property? How do I worry about all of the issues that I need to worry about as I form the company and then start to grow it? So we were lucky enough to have access to a fairly large multinational organization that approached us because of our subject matter expertise and the network of clinicians that we have, to leverage that in a way where we can create an accelerator program. And there are plenty of accelerator programs out there in other verticals, even in healthcare. But the biggest hurdle for a lot of accelerators, a lot of startups, is getting access to those subject matter experts or knowledge leaders.
Yeah.
Uh, so we're leveraging the network with this accelerator program to allow early stage startups now to go through a 16-week training program, which is supported by the fund, supported by the network, so that when they're pushed out at the other end of this, they now have gone through an educational process that allows them to do this in a fairly, I don't want to use the word standardized way, but certainly a supportive way, so that when they're finished with the program, they have access to capital for the company that they want to now accelerate beyond the accelerator. And we now have a network that has an ecosystem that helps them post accelerator to take them to the next level from a point of view of being able to raise money and then start to commercialize their idea.
Yeah. And if I'm correct, we're accepting applications now, right, for the first batch for the accelerator?
We are. We actually have been working on this now for a couple of months, and we are starting to take applications for companies across multiple areas of healthcare innovation, digital health, areas on platforms, areas on telehealth. So we're accepting applications for the program. The way it'll work is that we're going to have several sessions. We'll initially take applications from 30 to 50 companies, and then we'll do the due diligence and work with the companies in a very personalized way. Have a couple of 2 or 3 sessions and whittle it down to the 8 companies that will participate in the cohort for a 16-week program.
Okay. And how does a startup apply? Can they go through our website or should they email us? Like, what's
Yes,
the best for them?
it's interesting with this organization. We've been really accelerating to point a term about how quickly we're doing this, because we've been really trying to get this up and running. So we do have a website that we're releasing actually within a week.
Okay.
It's not out yet. Well, so they'll be able to apply on the website and then process themselves through this decision-making process. And then the winners will, 8 winners will have access to capital and a 16-week training program.
Nice. So definitely keep an eye on that from our website if anyone's interested in
Exactly.
that within a week. That's awesome. Yeah, I think we're doing a fantastic job. I'm very excited to build out the network and the communities with the education. Is there anything you'd like to add?
Yeah, I think we've made a lot of progress. It's not been, it's been a smooth, but it's not been an easy process to build this over the number of years, because there's so many moving parts to it. I mean, it's spectacular, Martin, to have you on board now with us,
Thank you.
and helping us with the member engagement and um, creating events and contents, content like this podcast, fireside chats, pitch events, um, basically events that actually attract members and our existing members and new members into the network, because it's quite educational for them. and it's a great experience. So it's great to have you on board, really helping to promote this. And what we're looking to do is we're spending a lot of time now growing the network and providing more services to our members in a way that allows us to grow both virally and through associations with other medical associations, other medical societies that can provide this entire clinician network of resources to their members. And we're trying to be that agnostic place for all those associations and multi-affiliated physicians to do a lot of this in a single secure environment.
Yeah, well, thank you. It's great to be part of this journey. I know we're going to be dropping a lot of great content, especially when it comes to the network side of things. So yeah, definitely stay tuned. We're going to be doing the clinician burnout series very shortly. If you already haven't listened, we actually have a Global Health Impact Fund podcast. Episode 1 is actually on Spotify and Google at the minute. It should be on Apple hopefully very soon. But yeah, Gary, I appreciate you joining me today and discussing the network. And I know we'll definitely have you back on going forward. So thank you so much.
I appreciate it, and thank you for having me. We invite all clinicians to participate and to join our network. It's easy to access us at www.globalhealthimpactnetwork.net. And I would encourage you to actively participate in this digital health revolution, because I think our approach and our goal is for clinicians to take back our intended position as guardians of healthcare, and that's our
Yeah.
goal.
Yeah. And just to confirm, like the network's not just for clinicians, but it's for everybody in health tech. So, if you're a lawyer or a consultant or startup, you can also apply to join the network as well.
Absolutely. As a matter of fact, I've trained myself over the last 3 years because of the approach that we're taking, that it is healthcare professionals, that it's everyone involved in the ecosystem of supporting the digital revolution.
Absolutely. Well, Gary, thank you so much. Again, I look forward to speaking with you in the future. Stay safe. And everybody, thanks for listening.
Thank you.
Bye-bye.
Thanks, Martin.